Okay, let's kick things off with a scenario that, honestly, is probably going to sound a little too familiar to a lot of us. Picture a super busy woman. She's juggling her family, crushing it at work, handling everyday stress, and basically just making sure everyone around her is perfectly taken care of. Because her calendar is just so jam-packed, you know what happens? She puts herself dead last. And in the process, she completely brushes off the little warning signs her own body is trying to give her. Maybe it's a bit of unusual bleeding, maybe it's some random pain she writes off as normal cramps, or just this constant, deep tiredness. She completely ignores these little whispers simply because she's way too busy keeping everyone else's world spinning. And right there is the trap. It's the danger of a phrase literally all of us have used at some point. It's probably nothing, right? Those three little words are incredibly dangerous. Months slip by, no doctor's appointment gets made, all because she assumes it's just the wear and tear of daily life. Until eventually a doctor's visit finally does happen, and suddenly she's hit with two words that change everything: cervical cancer. It's an absolutely devastating moment, and you know what makes it especially tragic? It's the fact that thousands of lives are lost every single year to a disease that is, frankly, highly preventable and treatable if caught early. So, to empower you, or maybe your sister, your mom, your partner, we are going to break down this silent threat step by step. In this explainer, we're going to cover understanding cervical cancer, spotting early warning signs, figuring out exactly who is at risk, the incredible power of prevention, and finally, breaking the silence around women's health. All right, let's dive straight into part one, understanding cervical cancer. Let's figure out exactly what it is we're dealing with here. First things first, what actually is the cervix? Well, it's the lower part of the uterus. Think of it as the vital gateway connecting the uterus to the vagina. Cancer in this spot happens when abnormal cells here start growing completely out of control. But, and this is an incredibly important but, this does not happen overnight. Not at all. It's actually fascinating and honestly kind of reassuring to look at the timeline of this disease. See, we start at a baseline of totally normal cells. Then there's usually a point of infection, almost always exposure to HPV, the human papillomavirus. Now, tons of people get HPV and their immune system just swats it away naturally. But sometimes, high-risk types of HPV hang around in the body for years, causing this very slow abnormal cell growth. It's only in the very late stages that this actually develops into full-blown cervical cancer. This slow timeline is absolutely crucial to understand because it proves we have a massive, years-long window to step in and stop it. So, knowing that this develops super slowly over years, let's jump to section 2 and explore what happens when symptoms do finally start showing up. Let's talk about early warning signs. Now, here's the crucial and honestly the scariest takeaway. In its very early stages, this is often a completely silent threat. There might literally be zero symptoms at all. None. Which is exactly why so many women, tragically, don't discover it until it's far too late. But as things progress, specific red flags can pop up. We're talking about unusual vaginal bleeding. Maybe that's spotting between periods or bleeding after intercourse. It could be physical discomforts like pelvic pain, pain during sex, or foul-smelling discharge. And in later stages, extreme, unexplainable exhaustion. Now let's be super clear, having these symptoms doesn't automatically mean you have cancer, right? But they absolutely 100% must never be ignored. I really want you to lock this powerful phrase into your mind. Your body whispers before it screams. It's so true, isn't it? Please listen to those early whispers. Pay attention to the subtle changes so you never ever have to face the scream of a late-stage diagnosis. Moving right along to section 3, we really need to understand the conditions and the habits that can actually increase your vulnerability. So, who is at risk? Well, there's a mix of variables at play here. Biologically, we're looking at things like HPV infections, or just having a weakened immune system overall. Then there's reproductive history, like having multiple pregnancies or early sexual activity. We also have to factor in lifestyle choices, especially smoking, and even medical history, like using certain long-term contraceptive pills without a doctor's guidance. But out of all these different factors, there is one single variable that towers over the rest. The absolute biggest risk factor of all. It's simply not getting checked. It's not your genetics, it's not a bad daily habit, it's avoidance. Whether it's driven by fear, maybe a bit of embarrassment, or just a lack of awareness, putting off those tests is what causes the absolute most dangerous delays. All right, let's pivot to the most hopeful part of this entire explainer. Section 4, the power of prevention, and exactly how we fight back. Get ready for an amazing fact. Cervical cancer is actually one of the very few cancers out there that can often be completely prevented. Yeah, you heard that right, completely prevented. Let's break down exactly how we do that. It all boils down to a super actionable 3-step plan. Step 1, the HPV vaccination. Think of this as your frontline shield. It protects young girls, adolescents, and even adults against the most common types of cancer-causing HPV. Step 2, regular screening. This means getting your pap smears and HPV tests. This is your early warning radar system, designed to detect tiny changes way before cancer even has a chance to develop. And step 3, a healthy lifestyle. Avoiding smoking, keeping up good hygiene, eating well, and just generally taking care of your immune system so your natural defenses stay strong. Now, even with all these incredibly effective, life-saving tools at our fingertips, there's still a massive cultural barrier standing in our way. So let's tackle that in our final section, breaking the silence. Just listen to these words. They're echoed by so many survivors. I wish I had known earlier. I ignored the signs. I kept postponing my checkup. Man, those are heartbreaking testaments, aren't they? It's what happens when women's health is still treated like some sort of taboo, off-limits topic. It all comes down to a really stark choice we have to make as a society. On one side, we have taboo and shame. That looks like suffering in silence, feeling embarrassed by perfectly natural bodily symptoms, or somehow viewing a medical screening as a sign of weakness. But on the other side, we have awareness and strength. That means talking openly about our symptoms. It means fiercely and unapologetically protecting your health. And yes, it means getting screened regularly. We have got to ditch the shame, folks. Taking care of yourself is never selfish. True awareness is true strength. Okay, we've covered a ton of crucial ground today. If you take absolutely nothing else away from this explainer, please let it be these 3 undeniable facts. Cervical cancer can often be completely prevented. Catching it early absolutely saves lives, and getting regular screenings truly matters. Do me a favor, share these 3 points with the women in your life. Seriously, one open conversation, one scheduled checkup, just one moment of real awareness can literally save a life. I'm gonna leave you with this final thought to chew on today. Will you give your health the attention it deserves before it turns into an emergency? Please take care of yourself, stay informed, and whatever you do, do not wait for the scream.